Hello, welcome. Thank you for tuning in. I'm Dr. Smart with Smart Skin Dermatology, and today we're talking about neurotoxins. Now, there's a variety of neurotoxins on the American market. Botox and Dysport are the most common and most commonly known names. So let's talk about neurotoxin, big picture, and who is the ideal candidate for this kind of treatment, okay? As many of you know, I'm sure you've heard the term Botox before, and if you haven't, it's fine, it's time. I don't know where you've been. But let's talk a little bit about the mechanism of action, so how it works, and then who's the ideal candidate. Botox and neurotoxins in general, they are muscle medicines primarily. They work by making the muscles move less in areas that we'd like to move the muscles less. That works with the skin because there are a variety of lines on the face that come from facial expression. And if those lines of facial expression are bothersome, then you might be a great candidate for neurotoxin or Botox. The ideal candidate for Botox is somebody who has resting lines or wants to try and avoid getting resting lines in their face by relaxing the muscle movement. We talk a lot about Botox raising or lowering things, eyelids and brows, but I think it's probably healthiest to think about it from the perspective of altering movement. Botox is not really changing anything other than how your muscles move. So it's the areas that are injected are relaxing, they're moving less, and your face is going, or the muscle that's injected is going towards a resting position. So the ideal candidate has lines in their face that are related to muscle movement that they'd like to not be there or be there as strongly, and they recognize that the treated areas are going to move less and approach a resting state. Now, some people have extremely heavy brows and lids, and what that means is that the Botox is going to make those areas that are relaxing settle, so they're not going to be less heavy on average. Some people have extremely active facial expression. They're used to using a lot of muscle movement in their face with every aspect of their interaction and conversation. And having less movement, even when it's very natural, is still something that's a little bit different. So the ideal patient also would recognize that it changes the way that muscles move. Also, the ideal patient would recognize that it doesn't last for very long. Somewhere between 3 to 5 months is the total action of the medication on average, sometimes less, sometimes more, but that's something to consider as well. So anyone really of any age that has lines or wrinkles in the face that are due to muscle movement that we want to make look better really should be considering Botox.